inform you about miscarriage, let's start. The pregnancy process is a unique and challenging period in itself. During this period, expectant mothers should manage a very careful and sensitive process and pay attention to have a healthy pregnancy by following all the recommendations of their doctor. However, no matter how much attention is paid, sometimes unwanted processes during pregnancy can cause miscarriage. Miscarriage is the early termination of the pregnancy process in the first 20 weeks of pregnancy due to unexpected reasons, and most miscarriages occur in the first trimester of pregnancy. A miscarriage does not mean that the expectant mother has done anything wrong. Miscarriage usually occurs out of control and occurs after fetal growth, stops with differences in the chromosome structure of the baby. What are the types of miscarriage? There are some types of miscarriage during pregnancy. Types of miscarriage can be classified as follows. Lost miscarriage. It is a miscarriage in which the expectant mother is not aware that she has a miscarriage. It does not have any symptoms. Ultrasound confirms that the fetus has no heartbeat. Complete miscarriage. This is a type of miscarriage in which bleeding occurs and the uterus is found to be empty. It is also determined by ultrasound. Recurrent miscarriage. It is seen in women who have had 3 or more miscarriages. Threatened miscarriage. This is a type of miscarriage in which there is bleeding and pelvic cramps. The pregnancy may continue without any other problems. The doctor monitors the expectant mother more closely during this period. Inevitable miscarriage. It is when miscarriage becomes inevitable with bleeding and severe pain. What are the symptoms of miscarriage? Miscarriage, which usually occurs in the first 20 weeks of pregnancy and occurs as a result of chromosome-related problems and fetal growth stopping, may start as a condition that the expectant mother is not aware of at first. Since the growth and development of the baby is not complete, it may be difficult for expectant mothers to realize that they are experiencing miscarriage. However, bleeding that occurs at the beginning of pregnancy can give an idea about miscarriage. Intense bleeding in the vagina and severe abdominal cramps during pregnancy can be a sign of miscarriage. The symptoms that the expectant mother may experience when miscarriage occurs during pregnancy are as follows: mild or severe bleeding in the vagina cramps, and pain in the lower abdomen, discharge of tissue or fluid from the vagina, intense back pain, breast tenderness, weight loss, white or pink mucus contractions decreased. Signs of pregnancy. Vaginal bleeding can vary from light spotting to heavy bleeding, including brownish discharge. The bleeding may come and go within a few days. When you experience these and similar symptoms during your pregnancy, you should consult an obstetrician immediately. Since it is a very sensitive process, doctor control is important. What causes miscarriage? Chromosome abnormalities cause about 50% of miscarriage cases. Along with chromosome problems, the growth of the fetus stops, the mother's lifestyle, and some diseases can cause miscarriage. Chromosome abnormalities. Intrauterine fetal death, burnt egg, molar pregnancy, partial molar pregnancy, infection problems in the immune system, kidney disease, maternal diabetes, hormonal problems, smoking and alcohol use, exposure to radiation and toxic substances, thyroid diseases, cervical insufficiency. Mother is over 35 years of age. Mom's weight, high blood pressure, food poisoning. Some medicines used, stress. In addition, exercise, sexual intercourse, and contraceptive pills are also rumored to cause miscarriage, but these causes have no proven validity. Whatever the cause of miscarriage, it is important that the mother does not blame herself. Most miscarriage cases occur outside the control of the expectant mother. What are the factors increasing the risk of miscarriage? Apart from the conditions caused by miscarriage, the following are among the factors that increase the risk of miscarriage during pregnancy. Age. Women over 35 years of age are at risk during pregnancy. The possibility of miscarriage is higher in the pregnancy of this age group. If you are pregnant after 35 years of age, you need to manage a careful and sensitive process under the supervision of a doctor. Previous miscarriages. Women who have had 2 or more miscarriages are more likely to miscarry again. Chronic diseases. Miscarriages are more common in women with uncontrolled diabetes, mellitus, uterine or cervical problems. Some uterine conditions and cervical insufficiency can cause miscarriage. Smoking, alcohol, and drug consumption. Women who smoke, drink alcohol, or use drugs during pregnancy have a much higher risk of miscarriage than women who do not. Weight status miscarriages have been reported not only in women who are overweight, but also in women who are underweight. Prenatal tests. Some invasive prenatal genetic tests, such as chorionic villus sampling and amniocentesis, increase the risk of miscarriage. How is miscarriage diagnosed? Symptoms of severe pain and bleeding can be a sign of miscarriage. Following these symptoms, the doctor will use an ultrasound test to listen to the fetal heartbeat and try to determine whether there is a miscarriage. He or she also needs a test to measure HCG, a hormone produced by the placenta. A low level of HCG can also be a sign of miscarriage. In addition to all this, the obstetrician may also use a pelvic examination to check whether the cervix has opened. In addition, for people who have had previous miscarriages, the doctor may request blood tests for both men and women by performing chromosome tests. How is miscarriage treated? If a miscarriage has occurred in the womb and the uterus is empty, no special treatment will be needed. The doctor will do an ultrasound to check if there is anything left inside your uterus. If a miscarriage occurs later in pregnancy and the fetus dies in the womb, the doctor will induce labor. If there is severe bleeding and the miscarriage cannot be prevented, the pregnancy is terminated by abortion. For women with threatened miscarriage, the doctor recommends treatment with rest. What are the symptoms after miscarriage? There are some symptoms experienced by women after miscarriage. These symptoms can be summarized as follows: fever, trembling, tenderness in the lower abdomen, vaginal discharge with bad odor. How to prevent miscarriage? It is not technically possible to prevent a miscarriage. However, the risk of miscarriage can be minimized. The expectant mother can spend the pregnancy process healthier by taking good care of herself and her baby. Here are the things to do to reduce the risk of miscarriage. Doctor appointments should be attended regularly. Smoking and alcohol should be avoided while pregnant. Weight should be maintained during pregnancy. Protect yourself from infections by washing your hands and staying away from sick people. The amount of caffeine should be limited. Do not forget to take vitamins before birth. A healthy diet based on fruit and vegetables should be followed. Regular exercise should be done. Frequently asked questions about miscarriage. What happens during a miscarriage? Bleeding, pain, and cramps occur during a miscarriage. Some cases of miscarriage can also occur without symptoms. You should consult a doctor as soon as you experience miscarriage symptoms. How to recognize a miscarriage? The most common symptom of miscarriage is bleeding from the vagina. Although it should not be forgotten that bleeding may last for a few days, this situation should be taken into consideration and should be checked. When can you get pregnant after a miscarriage? Considering the signs and symptoms that may occur after a miscarriage, it is recommended to get pregnant at least 6 weeks after the miscarriage has occurred. What color is miscarriage blood? The color of the blood in the vagina during a miscarriage is brown and bright red. How long does the bleeding last if a miscarriage occurs? The type of miscarriage is important for the answer to this question. Although the type of miscarriage varies from person to person, bleeding in the vagina can last 3-5 hours, while brown-colored bleeding, called spotting, can last 1-2 weeks. Thank you for watching.